A lot of overnight developments with the coronavirus to get to, and they're not positive. As of this morning, the U.S. has seen nearly 1.2 million confirmed cases, nearly 70,000 fatalities. That death toll already higher than one predicted just a few weeks ago, and unfortunately rising fast.
New this morning, Pfizer is announcing that human trials of potential vaccines are underway here in the U.S. The first participants are being tested at medical schools in New York and in Maryland. Savannah.
That's some good news. And the president begins traveling again today. He plans to visit a plant in Arizona that is making masks. That'll be his first trip on Air Force One since late March. We've got it all covered this morning. Let's start with NBC's Peter Alexander at the White House for us this morning. Hi, Peter. Good morning.
Hey, Savannah, good morning to you. The team behind this new model says their work was not finished, that the models are just preliminary to help the federal government prepare for the months ahead. But as states begin to reopen, they also say their information shows that the pulling back on social distancing practices too soon is likely to cause significant increases in the number of coronavirus cases and deaths.
The coronavirus crisis may get worse before it gets better. That's the warning from an internal Trump administration draft document obtained by the New York Times and confirmed by NBC News that estimates by June 1st the death toll could reach 3,000 a day, and the number of new infections could jump to 200,000 each day. The startling internal projections come as many states begin easing stay-at-home orders and start reopening their economies. While he was not involved in the models, Dr. Anthony Fauci says they make a point.
They're telling you something that's a reality, that when you have mitigation that's containing something, and unless it's down in the right direction and you pull back prematurely, you're going to get a rebound of cases.
Overnight, President Trump dismissing the projections, telling the New York Post, "I don't know anything about it. Nobody told me that. I think it's false. I think it's fake news." The White House saying in a statement this is not a White House document, nor has it been presented to the coronavirus task force or gone through interagency vetting. This data is not reflective of any of the modeling done by the task force or data that the task force has analyzed. Johns Hopkins University, whose researchers developed the data for FEMA to aid in scenario planning, saying these preliminary results are not forecasts, adding that the information illustrates how relaxing social distancing too soon could lead to significant cases and deaths. The creator of the model telling the Washington Post there are reopening scenarios where it could get out of control very quickly. After weeks of shifting estimates, the president revised his projection upward again on Sunday.
We're going to lose anywhere from 75, 80 to 100,000 people. That's a horrible thing. We shouldn't lose one person over this.
That view more optimistic than his own public health experts.
Our projections have always been between 100 and 240,000 American lives lost, and that's with full mitigation and us learning from each other of how to social distance.
And another University of Washington model, often cited by the White House, just revised its projection on Monday, now showing the death toll could reach 134,000 by early August. That's 60,000 more than they said just last week. The modelers say they revised their numbers because states are now easing those stay-at-home restrictions and people are increasingly going about their lives. Hoda?
Well, thank you, Peter. As you just pointed out, large portions of the country are pushing ahead with plans to reopen, and the debate over whether it is safe to do so is only getting more heated. NBC's Gabe Gutierrez is in New York City's Times Square. Hey, Gabe, good morning.
Hoda, good morning. New York's governor now says that the state will start reopening on May 15th, but it will be done on a regional basis, depending on how long certain areas see a decline in COVID cases. But around the country, patience is wearing thin.
Showing little regard for social distancing, protesters hit the streets outside another state capital, this time in Massachusetts.
If I'm going to get sick, I'll get sick, and if I get it, I'll get over it.
Now, more than half the country is at least partially reopened after at least half a dozen more states followed suit Monday.
I want to remind everyone to be safe, to be smart, and to be responsible.
Welcome news for some business owners in West Virginia.
It feels good to be back out doing what we love.
Controversial for others in states with ongoing shutdowns. In California, some city leaders and businesses are openly ignoring stay-at-home orders. Jeff Gowerly owns a restaurant near Los Angeles.
We got to get back to work, or the catastrophic effects are just going to be too much for us to handle.
Elsewhere, tempers have flared. In Michigan, 3 people are now charged with killing a security guard who authorities say was shot after a dispute with a customer over a face mask. Police are also looking for this man who wiped his nose on a clerk's shirt when he was asked why he wasn't wearing a face covering. USA! In Arizona, where emergency orders were extended, at least 2 county sheriffs say they won't enforce them.
We don't want to create criminals out of innocent people.
But after several crowded parties in Chicago, the mayor there has the opposite message.
If you act like a criminal and you violate the law and you refuse to do what is necessary to save lives in the city in the middle of a pandemic, we will take you to jail, period.
In Clearwater Beach, Florida, sun-soaked social distancing. This beach is open for the first time in weeks.
Not so worried as long as everybody, heeds to the guidelines.
But across the state in Miami Beach, one park is now shut down after police issued more than 7,000 warnings over the weekend to people not wearing face masks. Across much of the country, malls are opening too, complete with masks, sealed-off areas, and yes, long lines.
We're probably going to get viewed as not doing what we should by getting out, but we're going to do it anyway.
Here in New York, reopening bars and restaurants to dine-in customers will happen late in the process, phase 3. Arts and entertainment, including Broadway, will be phase 4. The governor has not given an exact timetable for that. Savannah?
All right, Gabe, thank you so much. And for more on this battle over reopening and what those new projections of cases and deaths could mean, we want to turn to Dr. Scott Gottlieb. He's the former commissioner of the FDA, a CNBC contributor. Dr. Gottlieb, good morning. It's good to see you. Let's talk about these projections. There was a draft that came out of Johns Hopkins, and we can almost set it aside because the author of that draft said it really wasn't ready to be released. But at the same time, you have the University of Washington, which is often cited by the administration, revising its projected death toll to 135,000 when it was 70,000 a couple of days ago. So the trend is obviously in one direction. What do you make of it?
Well, look, we still have a high level of infection in this country. We've reached a plateau, but we haven't seen the kind of declines that we were expecting to see at this point. And as we start to reopen the country, cases are likely to go up, not down. We're likely to see those case counts start to increase. The mitigation steps that we took were an attempt to try to prevent the healthcare system from becoming overwhelmed, and they worked to do that. The hospitals never really became overrun, but they were a bridge. They weren't a solution. They're not going to end transmission of this virus, but we did think that we'd be at lower levels at this point when we started to contemplate reopening aspects of the economy. And so as we go through May, we're likely to see the case count start to creep back up again.
That's what I'm trying to understand here, because we all remember, I believe it was in late March, when the White House said we could see a death toll of 100 to 240,000. Then a few weeks later, members of the administration, Dr. Fauci, the modelers, everyone seemed to agree. We think we can get it lower. Now we're already at 70,000, and now we're seeing projections go way back up again. So, what's the bottom line? Did social distancing really not get it done to the extent that was expected?
It depends on how you're assessing it. In terms of flattening the curve and preventing the healthcare system from becoming overrun, it worked very well. In terms of forcing the epidemic to really peak and then start to decline, we've really been at a sustained plateau now for about 30 days. And so we've been at about 30,000 new cases a day and 2,000 deaths for an extended period of time. We haven't started to see the declines that we expected to see right now. But remember, modeling is imprecise, and that's why we shouldn't put stock in any one model. It's not like forecasting the weather where you make a prediction and then you see what happens. You make these predictions and then you take actions based on those predictions. And so you're affecting the outcome based on the model results that you're getting. So we took certain actions. We got more stringent based on those early models that showed very grim forecasts. Some of those didn't come to pass. I think what we expected to see at this point, though, and certainly I expected, was that we'd see sustained declines in new cases around the country. And once you back out New York, where you really have seen those sustained declines, around the rest of the country, cases are actually going up. There's about 20 states where cases are going up on a daily basis, and so are hospitalizations.
Well, that's what's kind of surprising about all of this. You said no question the mitigation worked, so the hospitals weren't overrun, healthcare workers weren't overrun. Granted, they have had to deal with an unprecedented amount of sickness and disease. But at the same time, you're also saying we're actually not seeing those declines. We're seeing a plateau or even going up if you take out New York, which was the epicenter.
That's right. And I think that we need to understand this may be the new normal. We may not be able to get transmission down much more. I hope we can. But as we reopen the country against this backdrop where there are tens of thousands of cases a day, in most likely scenario is that cases go up, not down. And so we need to think about what it looks like in the country if we have transmission of this virus and we try to get back to some sense of normalcy. And I think it means we have to protect vulnerable populations, which end up being disadvantaged Americans, people who work in conditions where they can't socially distance. That's why you see outbreaks on shop floors like meatpacking plants. So we've got to get personal protective equipment into those settings so people can protect themselves at work. We need to think about the places of vulnerability where if you have this virus continuing to spread, there's going to be certain populations that are more vulnerable to it, and we need to do more to protect them.
Yeah, we just got to be so careful, don't we, Doctor? Thank you so much for your time this morning. We really appreciate it.
Thanks a lot.
All right, Hoda.
All right. Thank you, Savannah. 7:13. Also this morning, the war of words is intensifying between the United States and China over the origins of the coronavirus pandemic. The latest salvo, Chinese state media labeling Secretary of State Mike Pompeo evil for suggesting the virus leaked from a lab in Wuhan. Today, senior international correspondent Keir Simmons joins us with that story. Good morning, Keir.
Hey, Hoda, good morning. And this morning, substantial pushback against those Trump administration suggestions that this coronavirus could have leaked from a lab. Before those comments, U.S. intelligence officials had told NBC News that there was no smoking gun evidence. But, Hoda, this morning, there are still questions over why China hasn't agreed to an independent international investigation.
This morning, a deepening diplomatic row over the coronavirus. The Trump administration warning of a backlash inside China against the Communist Party for punishing doctors who speak out. The Deputy National Security Advisor, Matt Pottinger, declaring in Mandarin, when small acts of bravery are stamped out by governments, big acts of bravery follow. While Chinese state television branding the U.S. Secretary of State insane and evasive, a Chinese Communist Party newspaper calling him a liar for these comments.
I can tell you that there is a significant amount of evidence that this came from that laboratory in Wuhan.
But in an interview published overnight, Dr. Anthony Fauci says he does not believe the virus was made in a Chinese lab, not directly weighing in on the theory it may have escaped from the lab, saying the scientific evidence is very, very strongly leaning towards this could not have been artificially or deliberately manipulated. While Australia's Prime Minister asserting that the virus likely emerged from a Wuhan wet market.
What's really important is that we have a proper review, an independent review.
And the World Health Organization weighing in too, saying it has not received any evidence of the Trump administration's allegation that there may have been a leak from a lab.
We have not received any data or specific evidence from the US government relating to the purported origin of the virus. So from our perspective, this remains speculative.
Around the world, Chinese officials have been waging an aggressive pushback against allegations China concealed the coronavirus. The Chinese ambassador to the UK posting comments accusing the US of spreading propaganda.
National leaders of the United States, start this campaign of disinformation.
But one German lawmaker tells NBC News it's China that has been using coronavirus aid shipments for self-promotion and more.
They try to erase any kind of critical view of that, what's going on inside China by giving masks for free.
And this morning, a new warning to the Chinese Communist Party that anti-China sentiment is at its highest around the world since the Tiananmen Square crackdown. That's part of a report that Reuters says it was briefed on. That report has not been reviewed by Reuters or by NBC News, but it is said, Hoda, to warn that the anti-China sentiment could lead to even a military confrontation. Hoda?
Oh, okay. All right. Keir Simmons, thanks so much. Savannah, over to you.
I think we need to take a pause here. It's easy to get lost sometimes in all these numbers and statistics, but we should mention, each and every day there are coronavirus patients who get out of the hospital, they recover, they head home to loved ones. Here's one. That's Ruthie Ramirez, and here she is being reunited with her 2 kids. They were apart for 25 days. You know, she was declared critically ill. She was intubated in mid-April, but now she has made a full recovery. She gets to go home, and you know, these guys have a lot to catch up on, don't they, Hoda? Isn't that sweet?
Oh my gosh, Ruthie is loved. Boy, that was beautiful. All right, well, we've got now 7:17. Mr. Roker, we say good morning to you. Hey, Al.
Hey guys, good morning, and we are looking at a line of showers that stretch from the Dakotas all the way to the mid-Atlantic, and it is pushing to the east. We're going to watch this closely during the day today. Some heavier showers and thunderstorms through the Ohio River Valley. We do have a risk of severe weather from this afternoon into this evening into parts of Texas, I should say Georgia, also into South Carolina, North Carolina, and parts of Tennessee. This will move into the mid-Atlantic, this low pressure system with rain and scattered storms. Tomorrow, the storm will intensify offshore, bringing rain, and it's going to draw in colder air from the northeast, and it is going to be a nice, not a very nice day through tomorrow, starting and then going right on into the weekend. Look for anywhere from a half an inch to an inch of rain, especially to the mountains of West Virginia and Western Virginia as well.